Coronavirus and COVID-19. It was first discovered in Wuhan, China, and quickly spread to other China cities and all countries. COVID-19 is newly found virus that causes an infectious illness. The majority of patients infected with the COVID-19 virus will have mild to moderate respiratory symptoms and will recover without needing any specific therapy. COVID-19 had a wide range of effect in different nations, owing to a variety of circumstances such as government actions, demographic, and healthcare infrastructure.
While countries around the world are lifting their lockdowns, Thailand is struggling to overcome a resurgent wave of COVID infections.
Thailand, a famous tourist destination for Chinese visitors, was where the first COVID-19 patients outside of China was discovered on January 13, 2020. The first incidents of domestic transmissions and the 16th patients in Thailand were discovered towards the ends of the same month. The number of COVID-19 cases remained low until mid-March, when domestic infections began to increase. A boxing match at Lumpin Boxing Stadium on 6 March 2020 was a key event despite prohibitions on large gatherings that had been imposed just days earlier. Thailand's reactions to the COVID-19 pandemic was being guided by the Ministry of Public Health Integrated Plan for Multilateral Cooperation for COVID-19 Safety and Mitigations, which had been drafted with the proceedings goals and objective, which is reducing the risk of the virus spreading into Thailand, ensuring that everybody in Thailand and Thais living abroad is safe from COVID-19 and increasing national security while reducing health, economic, and societal consequences.
The Thai government's initial response, which included shutting the borders, helped prevent the spread of COVID last year. But a lack of planning and vaccination has led to a much stronger second wave, with ordinary people hit the hardest.
Thailand has confirmed the first case of the new coronavirus outside China. A Chinese woman had the infection that linked to a pneumonia outbreak in China. The 61-year-old person has traveled from the Wuhan, where the outbreak has started. Thai officials appeal for calm, saying the woman no longer has a fever symptoms. Thailand public health reaction was prompt and extensive. Rapid response teams handle confirmed cases immediately by isolating and treating patients, as well as tracking and quarantining their close contact. The Ministry of Public Health in Thailand also raised the numbers of hospital beds ready to handle mild, severe, and critical patients after analyzing the healthcare capacity. Also, the medical supply needs, including personal protective equipment, were established by the health official for all institutions. As the outbreak reached a climax in late March 2020, the government departments worked together as part of the newly formed Center for COVID-19 Situation Administration (CCSA) under the direct Prime Minister direction. Besides that, international and domestic flights were cancelled and the residents were cautioned to not travel between states, and people were encouraged to keep their distance and stay at home. Currently, Thailand reported 195,909 COVID-19 cases as of June 13, 2021, with 154,414 recovered cases and 1,449 fatalities.
Next is the implication of COVID-19 in Thailand. The first one is the impact to Thailand's economy. According to the World Bank's latest Thailand Economic Monitor, Thailand's economy will be significantly harmed by the COVID-19 epidemic, declining by at least 5% in 2020, and pre-COVID-19 GDP output levels will take more than 2 years. This COVID-19 epidemic stunned the economy, particularly in the second quarter of 2020, and has already resulted in massive employment losses, hurting both middle class and impoverished households. The second one is the impact to Thailand's labor market. The unemployment rate grew to 2% in the second quarter of 2020, according to National Statistics Office. That would be nearly 3 times Thailand's 10-year unemployment rate, which was roughly 0.6%. In addition to the 6 million farmers already damaged by drought, the Office of the National Economic and Social Development Council (NESDC) anticipated that the COVID-19 epidemic will threaten 8.4 million jobs in the second and third quarters of 2020. Thailand's core industry have been particularly hard damaged. Lastly, the impact to Thailand's tourism. According to the Tourism Authority of Thailand (TAT), international visitor numbers might drop by 60% from 39 million in 2019 to 16 million in 2020. The governor of TAT also stated in April that Thai tourism will not recover until a vaccine is developed, which might take a year. TAT estimates that international tourist revenue will drop to 1 trillion baht in 2019, down from 1.9 trillion baht in 2018.
There are several solutions or recommendations that can be highlighted in this topic, which is first by policy recommendations. This effort can be done by strengthening the institutional capacity and transparency in delivering correct information to public, and then strengthen the whole of society approach to counter misinformations. At the same time, establish a regulatory framework to prevent the disseminations of misinformation in social media. Secondly is deploying universal precautions. Thailand is the only country in ASEAN to have deployed the universal precautions in fighting against COVID-19. The public health officials urge everyone to wear a face mask at all times and take care of personal hygiene almost as soon as the first case was announced. Such an approach allowed most people to prevent the virus from spreading, so random testing is not needed. Instead, testing has been carried out only for those confirmed cases. Thirdly, resilience Thai public. There is a Thai saying, "Autua rot pen yot di," which is meant to save oneself is a great task. Obviously, without public participations and cooperations, the outcome of antivirus measure will be different. It must be noted that the Thais tend to follow guidelines from professional people, especially doctors. If the daily briefing was conducted by the government's spokespersons without medical knowledge and optimism, it will have not been effective. After that is leadership quality. Government officials have given full credit to the government of Prime Minister Prayut Chan-o-cha for overall decisiveness. Others have entertained different views. Provincials and local authorities have also displayed their unique capacities to manage the pandemic in their localities and communities. However, to be paid, Jan Prayut should be praised for his decision to allow public health professionals to take charge. Before setting up the Center for COVID-19 Situation Administrations, there was no leadership in directing the fight against the virus. Each agency was doing its own things without coordinations. The CCSAS centralized the entire antibiotics campaign to fight the virus. Lastly will be the fact-based communications. On March 23, when the CCSA appointed a spokesperson, Dr. Tawasip Bisanoyotin, the whole dynamic of discourse on the pandemic situation changed dramatically. This charismatic spokesperson has been able to generate public trust in his daily briefing. His official but raw data has generated acute awareness of what must be done to prevent the spread of virus. Dr. Tawasip was able to communicate directly with the public, and This resulted in growing awareness, subsequently translated into solid understanding and cooperations.
This is what streets across Thailand should look like this week. Here, locals and tourists in Bangkok's backpacking hub of Khao San Road out en masse, celebrating the Thai Songkran New Year with parties and water fights. But on Khao San Road this year and nationwide, the party has been cancelled. A recent spike in COVID cases, thought to have started at nightlife spots in Bangkok, has raced across the country. Thailand has been viewed as a COVID success story with low infection rates. But now a third wave is here, throwing cold water on the hopes of many in the tourist and hospitality industry, just as it was positioning for a rebound.
While Thailand's react to COVID-19 has been relatively effective in terms of preventing the disease transmissions, it falls short in terms of dealing with the problem's numerous dimensions, such as the economic and social consequences. The Sendai's framework from disaster reductions demonstrates that how Thailand's response to COVID-19 does not fully address the problems of resilience, with only minimal considerations given to developing resilience against climate change or other epidemics. The COVID-19 pandemic recovery provides an opportunity to do so while leaving no one behind. In order to address current gaps and move towards a sustainable society, an inclusive long-term recovery strategy for the different afflicted nations must adopt a comprehensive approach.
Only about 500,000 doses of COVID vaccines have been given to the population of 69 million people. Some in the opposition see the lagging vaccination program as one of multiple failings by the administration.
They really underestimated the severity of the crisis and failed on sourcing more vaccine options. They did not continue with COVID readiness set at the beginning of the pandemic. They were not ready to immediately respond to this wave.
Wishing that next year Songkran will again look like it's supposed to, most Thais will be closely watching the infection rates over the next 2 weeks, hoping there won't be a spike after everyone returns to work after the holiday, raising the possibility of a happier new year.